Hi, everyone. Welcome and thank you for joining us today. This is Christina Honeysett speaking. I'm the Director of Public Relations here at Vital Strategies. Vital Strategies is a global health organization that works with governments and civil society around the world with the vision where all people are protected by a strong public health system. Our speaker today is Dr. Tom Frieden. He's the president and CEO of our Resolve to Save Lives initiative. Dr. Tom Frieden is a former director of the U.S. Centers for Disease Control and Prevention and former commissioner of the New York City Health Department. He is currently president and CEO of Resolve to Save Lives, an initiative of Vital Strategies funded by Bloomberg Philanthropies, the Chan Zuckerberg Initiative, and the Bill and Melinda Gates Foundation. Resolve to Save Lives works with countries to prevent 100 million deaths from cardiovascular disease and to make the world safer from epidemics. So for those joining us today on Zoom, just a note, we will be using the Q&A function at the bottom of your screen for questions. If you have a question during Dr. Frieden's remarks, please enter it into the Q&A box. We will make every effort to answer as many questions as we can get to today before the briefing ends at 11 a.m. And a note for those dialed in, please send your questions to press@vitalstrategies.org. We have staff members monitoring the inbox for questions, and those will be directed to our Q&A moderator, my colleague, Ali Davis. And with that, I will hand it over to Dr. Tom Frieden.
Thank you. I'm joining you today from my home in Brooklyn, New York. The number of deaths in New York City from COVID-19 is horrifying, and it's beginning to approach the level of the 1918-1919 influenza pandemic. Then there were an estimated 30,000 deaths in this city in 2 flu seasons. Now, in less than 2 months, approximately 15,000 New Yorkers have already died from this disease. This is a warning. Everyone needs to take this virus very seriously. If any location underestimates how harmful it can be, this can be a deadly and dangerous error. Since the novel coronavirus started circling the globe, it has forced much of the world's population into hiding, shutting economies and travel. This necessary withdrawal has slowed the explosive spread of the virus to flatten the curve of new infections. But this is only one half of what we must do. Sheltering in place is just a strategic retreat. We're not fighting the virus. We're trapped in our homes, wrapped in our fears, isolated in our hospitals. In order to go back out and reopen, we need to put the virus in a box. We're calling this strategy Box It In. This is the other half of the control strategy, following on the flattening the curve approach. And we need to implement this strategy with the speed of the virus. Yesterday's proposed guidance from the White House is a step forward. Their guidance will help states build plans to reopen. Boxing it in is a crucial step to reopening as soon and safely as possible. As the guidelines indicate, different parts of the country will be ready to reopen at different times. The sooner they build the 4 corners of this box, the sooner and more safely they can start to reopen. There are 3 key objectives to our battle with the virus: reduce the number of infections, reduce the number of deaths, and reduce the social and economic harm. We've developed this strategy based on extensive input from people on the front lines of this fight around the world and throughout the United States. Many dedicated public health professionals have contributed ideas to it, and we thank them for that. There are 4 essential actions to box the virus in. All 4 are crucial. If any one isn't done well, the virus can escape from the box and spread explosively again. Success requires a massive expansion of our public health capacity around the country and around the world. The first corner, expand and prioritize testing. We must make diagnostic tests widely available and faster to quickly identify newly infected people. Without prompt, accessible, and well-targeted testing, the virus will open new lines of attack, create new clusters, and spread illness, death, and economic dislocation. Depending on the level of control, the number of cases and contacts identified, and decisions about the frequency and extent of testing in nursing homes, hospitals, and essential services, the number of tests being done per day could need to increase by a factor of 3 to as much as a factor of 20 compared with the number of tests done today, which has been less than 150,000 per day in the US. Some people need to be prioritized for testing. This includes healthcare workers and people with congregate settings who have symptoms. This prioritization will help guide our efforts to reduce deaths in high-risk groups and limit the number of new infections. The second corner, isolate infected people to prevent disease spread, is essential to support every infected person so the virus stops with them. People who don't require hospitalization but can be safely cared for in their homes will need supportive housing until they're no longer infectious. Hospitals must safely care for and isolate patients and reduce the risk to healthcare workers. The CDC recently reported that more than 10,000 healthcare workers in the United States were infected with the virus in the first 2 months of the outbreak. This is completely unacceptable. We must implement a range of actions, including but going far beyond adequate personal protective equipment to protect our frontline heroes. And the nation's 15,000 nursing homes need to take extraordinary action. In early March, I said that nursing homes are ground zero for COVID deaths. By mid-April, more than 2,500 nursing homes had reported cases and nearly 4,000 staff and residents had died. That number has been increasing rapidly. In some areas, nursing homes account for nearly half of COVID-19 deaths. Unless we take extraordinary preventive measures, every nursing home in the country could have an outbreak, and this could kill 300,000 people or more. Other congregate settings, including prisons and homeless shelters, also need to support and safely isolate the infected. Singapore has excelled at protecting its healthcare workers. It has successfully isolated them from the virus by reducing exposure, having staff work in cohorts together, and ensuring adequate protective equipment. The third corner, trace and support contacts who may have been exposed. To get ahead of the pandemic, we must trace the contacts of infected people and warn them of their exposure. Contact tracing is a basic public health activity and an essential tool for epidemic response. Contact tracing can prevent a single case from becoming an outbreak and an outbreak from becoming an epidemic. The idea behind contact tracing is simple. In an epidemic, infection isn't passed simply from one person to another in a chain. It spreads more as if in a web. If just one part of that web is missed, the virus can continue to spread throughout the community. Just as governments provide hurricane warnings so people can protect themselves and their families, it is an essential function of a responsible public sector to warn people who've been exposed to coronavirus so they don't spread infection to their loved ones, their neighbor, their community. For this unprecedented effort, we need to build, train, and supervise a core of contact tracers nationwide and address the public's concerns about confidentiality and privacy. Some technologies may be able to improve the efficiency of this process, but new digital tools are only likely to supplement and not supplant traditional public health contact tracing. It's important to understand what's involved in the contact tracing process. When done correctly, contact tracing addresses confidentiality and privacy concerns while allowing governments to take appropriate protective action. The name of the index case is never revealed to a contact. Cases, as well as their contacts, are treated as the VIPs of the program because they deserve it, because it's the right thing to do, and because doing so increases the likelihood that we'll stop the chain of transmission. Contact tracing programs should include services for those in isolation or quarantine to make the experience as safe and as least disruptive as possible. This may entail providing accommodations if a person's home circumstances aren't safe, for example, an ill patient living with vulnerable household members, medical services, social services, food, and even offsetting lost wages. In Wuhan, China, there were 1,800 contact tracing teams of 5 people each. That's roughly 1 disease detective per 1,000 residents. Nationally, China has tracked more than 720,000 contacts, isolating those who became infected. This has been critical to stopping the spread of the disease. In a well-functioning program, most and ideally all new cases arise among contacts who've been quarantined. For this to occur, nearly all cases need to be found, all contacts identified, all identified contacts quarantined, and all quarantined contacts, particularly those with symptoms, tested. This is the essence of the box it in strategy, creating a closed loop so that with each wave of infections, there are fewer and fewer secondary infections, boxing the virus in and opening more and more space in society for safe movement. The fourth and final corner is quarantining contacts. People who came into contact with cases may have been infected. They are the leading edge of the pandemic. We must provide them wraparound services so they can quarantine themselves until infection is ruled out. Quarantined people who've been exposed to COVID-19 have a 14-day period after exposure to prevent the spread of virus. Quarantine entails a complete separation from everyone outside the immediate family, and for safety reasons, separation at least from older and medically vulnerable people, and perhaps from everyone in the household. No travel outside the home is allowed. Food and other necessities must be delivered or provided. Although some people can easily stay at home and work or go to school remotely, others need special support. We have to ensure that medical and social services are readily available, so quarantined people can be tested and isolated at the first sign of illness. This could mean providing groceries or meals, addressing social and health concerns, supporting remote work and school participation, or even providing housing for those unable to self-isolate because they live with an elderly parent or someone with a compromised immune system. Jurisdictions seeking to successfully manage quarantine activities can look to places like Singapore, Taiwan, and South Korea, which have established strong support systems for people in quarantine. Some governments have set policies to support home delivery services. Others have engaged neighborhood committees and voluntary groups. Some locations have even provided unlimited Netflix access for people in quarantine. The physical distancing measures we've taken have begun to flatten the curve, but they've been hugely disruptive. We are all eager to resume economic and social activity. Sadly, despite the devastation the pandemic has caused, it is still a major risk. Only a small proportion of the population has been exposed, and the vast majority of people remain susceptible. The drastic and life-saving actions that we've taken to shelter in our homes amount to little more than hiding inside. We've yet to even begin erecting strong defenses. With strategic, swift, large-scale action, we can get ahead of the virus and take the offensive. The 4 actions described in our new report, test, isolate, trace, and quarantine, are all necessary for the success of control of COVID-19 to box the virus in. If any part of this box is weak, the virus can escape. Bottom line, we must work quickly and begin preparing right now for the next phase of fighting the virus. We have to lay the groundwork for a safer, more cohesive response to future pandemics as well. We will be stuck inside until we take rapid steps to box COVID-19 in. Only public health can guide us forward. It's not about when we can reopen, but what we have to do to make that day come sooner. For people at home, there are 4 things you can do to support each of the 4 corners of this box. Testing. If you're in a priority group for testing, get care. If not, understand that the best way to protect yourself and your community may be to wait until testing is more widely available. Second, isolate. If you have the infection, understand that it can be highly contagious. Take every step possible to make sure the virus stops with you. Contact trace. If you have the infection, help warn those at risk. Quarantine. If you may have been exposed, quarantine yourself. Even if you don't feel sick, you could be infectious. So you need to stay apart from others until the risk period has passed. This virus is affecting everyone in society, and all of us have a role to play boxing it in. Governments, healthcare organizations, nursing homes, community, religious, and social organizations, and an informed public must work together to stop the virus from spreading and reopen one step at a time as soon and safely as possible. Thank you. And now I'm happy to take your questions. Allie?
Thank you, Dr. Frieden. As a reminder, we will be using the Q&A function at the bottom of your screen for questions today. If you have a question, please enter it into the Q&A box. We will make every effort to answer as many questions as we can before today's briefing ends at 11 a.m. If you are dialed in, please send your questions to press@vitalstrategies.org. We have staff members monitoring the inbox for questions. Dr. Frieden, our first question comes from Morgan Chalfant at The Hill. Do you think that the White House guidelines released Thursday should have included specific metrics on the level of testing needed to safely begin the phased reopening of states and counties? What does the federal government need to do to address testing shortfalls?
Well, there are several aspects to that question. There's a lot that needs to be done, and the federal government needs to lead to get the supply chain right for every aspect of testing. That includes not just the test materials themselves, but swabs, transport media, and also information systems so that test results are rapidly conveyed to both the healthcare provider and public health system. I will say that the report that we released today, and I encourage all of you to read it because it does have quite a bit in it. I've outlined some of the basics, but there's much more that's there, has both a section and an annex on testing. And one of the key points is that we need to prioritize those who most need testing. That includes people with symptoms of COVID, that includes contacts of cases, healthcare workers with symptoms, people who live in congregate facilities and have symptoms that could explode into an outbreak, and ideally every hospitalized person so that we can stop spread of this disease in our hospitals. And that's just the first step of the testing needs. The exact number of tests will depend on the number of cases in a community, the number of hospitalizations. What we know is that if you just look at the numbers, there are at least 3 times more people in those high-risk groups than are being tested today. So yes, expansion of testing is important, but it's not the only thing. It is one metric we should monitor, but each of those 4 metrics are important. That's why we've thought more about triggers for how to assess whether the states are ready to open and can safely reopen. This is something that can't be decided on theory alone. We have to try different benchmarks, see if they work, and improve them over time. This is a brand new virus, and the more we understand it, the better we can protect people and take actions that balance protection of public health with limiting the harms of the economy.
Thank you. Our next question comes from Thomas Howell at the Washington Times. What is the main impediment to diagnostic testing? Is it acquiring the test kits or supplies that support the tests? Or is it coordinating lab capacity? What role should the federal government play?
There is a whole supply chain for tests, and the federal government needs to assess every level of that supply chain and make sure that it's robust. Because if any part is weak, there are going to be delays. And from what I'm reading in the media and hearing from my colleagues on the front lines and understanding from the details of test kits, we are weeks, if not months away from having a sufficient number of tests. That's why it's so important to understand that testing is just one part of a comprehensive strategy. And there's lots we can do even while that strategy, even while that capacity for testing is being built. We have to improve infection control in our hospitals and nursing homes, provide housing for infected people, support those who are presumed to have infection in places like New York City, where there are not nearly enough tests, and we're encouraging people with mild illness to stay home. Start creating that army of contact tracers and figure out how we're going to support people in quarantine. All of those 4 things are needed. If we're just focusing on the test, we're not skating to where the puck is going. And where the puck is going is needing to do each of those 4 things right to box the virus in.
Thank you. Our next question is from Mike Stobie at AP. Dr. Frieden, you said we've begun to flatten the curve. Do you think coronavirus illnesses have peaked? What measure are you watching to answer that question? And what do you think of the gating criteria discussed in the White House reopening plan released last night?
Thank you, Mike. Series of questions there. I'll try to answer them all. We're at different places in this epidemic in different parts of the country. Overall, we are peaking and coming down as per the latest information, but that can change in any city, in any place overnight. And the big question is, what will happen as we begin to loosen the faucet? It's so important to understand that staying in home, sheltering in place, was just half of the strategy. That's a strategic retreat. The other half is going on the offensive against the virus, and that's what the box it in strategy is about. In terms of the indicators to look at to see, are we ready to reopen? Will we have to tighten the faucet again? I think the general concepts from the White House are good. They're sound. They need to be applied specifically. We need to look, for example, at how the virus is changing. Not only the number of cases, but the number of deaths needs to be coming down regularly. We need to see a case rate decreasing, and we may need to think about a maximum case rate above which it will be very difficult for any jurisdiction to control the virus. So one is the virus itself. The second is our healthcare system. Is our case fatality ratio coming down? In other countries, they've been able to get it to less than 1%. That reflects both a lot of testing and good clinical care. And are we protecting our healthcare workers? Ideally, not a single healthcare worker should become infected. We need to do much, much better at protecting the front lines here. Third, is our public health system ready to do that contact tracing? Are we finding most cases from quarantined contacts? As cases come down, we need to scale up those activities with or without sufficient test capacity until that test capacity is here.
Thank you. Our next question is from Hilmar Schmunt at Der Spiegel. How many contact tracers does the US need? More like 30,000 or in the tune of 300,000? Could tracing and tracking apps help them trace infection contacts? What are the advantages of personal tracing by actual humans as opposed to tracing with apps?
The exact number of contact tracers needed will depend on several things. It will depend on the number of cases. More cases, more contact tracers. It will depend on the number of contacts per case. Right now, with people sheltering in place, that number may be very low, 2 or 3. But when people are out and about, it could be 30 or 40. It will also depend on the efficiency of the process and on the participation of people. The more people participate, respond to phone calls or emails from the health department, provide detailed locating information for their contacts, provide information on their status every day, the easier it will be. So we all have a role to play here. The issue of technology in the support of contact tracing is an important one to assess. This is fundamentally a person-to-person process. It's about talking to someone, earning their trust, keeping their trust, protecting their confidentiality, and helping them remember who they were in contact so that we can warn those people that they've been exposed. It's not similar to a hurricane warning. You expect the government to tell you if a hurricane is coming so you can protect your family and loved ones and neighbors. In the same way, a responsible government needs to warn people that the coronavirus exposure may have occurred so they can protect their families. There are some digital technologies that we think are likely to be helpful. Things as familiar and straightforward as call center technology, workload systems, ways of assigning work from one person to another, better ways of locating people who may be difficult to get in touch with, better ways of helping cases remember who their contacts are, and simple ways of contacts logging in and reporting their symptoms every day. Some of the discussion of what's called proximity tracing, I think, may overpromise. It's not clear that phones will be able to say who was in contact with who when at a high enough or accurate enough rate to be very useful. But it's important to evaluate this type of tool because we need to try everything to slow this virus down and protect people in our communities. But contact tracing is always done with the consent of the person being with whom this is being discussed, and it's done sensitively so that privacy is respected.
Thank you. Before we move to our next question, I'd like to let everyone know that the report we released today is available online at preventepidemics.org on our coronavirus resources page.
And if I can just add, Ali, in addition, we're posting many resources that we've collected from around the world on things like contact tracing, because we need to learn from each other. Each country, each community is learning lessons here. And whether that's the best way to communicate with a patient, or digital tools that may be helpful, or services that are available to contacts and to cases that encourage them and protect them and support them through that process. This is a global battle against a common enemy, the dangerous microbe. And the more we learn from each other, the better we can do.
Thank you, Dr. Frieden. Our next question comes from Dan Goldberg at Politico. States are scaling up contact tracers very quickly. Some are using college students, others are recruiting volunteers. We've heard some concern from public health officials that this is happening too quickly to properly train contact tracers for this important work. Are you concerned that in the rush to reopen the economy, contact tracers won't get the training they need? Or is it easy enough to do that and you can quickly train tens of thousands of people across the country?
Well, on the one hand, we need to move as fast as possible. We need to move with the speed of the virus. On the other hand, learning contact tracing is not easy. It's a skill. It requires a lot of people skills. Training is very important. Listening to someone, understanding their concerns, helping them remember. So this is not a simple process, but it is a process that can be taught. And the sooner we have good training materials that are online, practical, useful, the better off we'll all be.
Our next question comes from Betsy McKay. The administration's gating criteria specify that the number of new cases must decrease for 14 days. Should there be a number of daily new cases states must get down to before they can reopen? If so, what is that number?
Thank you, Betsy. That's a great question. We've thought about it. I believe our report mentions that one threshold some have considered is no more than 40 new cases per day per million population. But all of these thresholds need to be stress tested. They need to be tried out. Maybe that number is too high, maybe it's too low, maybe there shouldn't be a number. We need to try things, see what works, and improve our programs and procedures based on that experience. A good public health program uses data to improve performance. A great public health program uses real-time data to improve performance. The reason that some have talked about 40 per million is it is a level of effort that is conceivable to address in terms of the amount of testing, the amount of contact tracing. At very high rates of disease, it's really not conceivable that we'd be doing the testing and contact tracing that we need. Take New York City today, where there have been many thousands of infections per day in the weeks that have passed. To try to test, contact trace all of those would be, even with a massive army of contact tracers, would be just too much. But as cases come down into the hundreds in New York City, there does need to be a steady scaling up of the box of testing, isolation, contact tracing, and quarantine. So I think numbers like that, thresholds, are not magic. There's no perfect right answer to be identified. What we need to do is try something and assess rigorously whether it's working, whether it's feasible.
Our next question is from Xiaofeng Wang. Apart from contact tracing, do you think massive blood tests for COVID-19 antibodies will help reopen the economy?
Testing for antibodies looks for past or current infection, as opposed to testing for the virus itself, which indicates, if positive, potential infectivity of the individual. For the serological testing, there are two main values. One is to assess the community spread of the virus, to see how widely it has spread and track overall over time what's going on with the epidemiology. The second is to indicate if individuals themselves have antibodies to the virus. These may indicate some level of immunity. We don't yet know whether those individuals are safe from reinfection. We don't yet know, if they are, to what extent or for how many months or years that immunity will remain. We hope it'll be good. It may be good, but we don't know yet. Right now in New York City, there are tests recruiting volunteers with antibodies to provide blood or plasma for people who are very sick with COVID. That's one possible way of confronting the virus and of treating people who are very ill.
Thank you. Our next question comes from Nathaniel Wexel at The Hill. How will interstate travel be impacted if different states are seeing a case surge and decline at different times and are at different phases of the reopening? Can you ensure that people aren't bringing in the virus with them across state lines? And if a state does reopen too soon and people start getting sick again, do we have the capacity right now to stop an outbreak before it gets out of control? Will the president,
Sorry, please go ahead.
Will the president's guidelines with no specific numbers to determine case decline give governors an incentive to hide or somehow fudge their numbers to provide a justification for reopening sooner? Big question.
3 questions. I'll see if I can remember them all. In terms of cheating, you can cheat on the numbers, but you can't cheat the virus. If locations reopen before they're ready, they are at high risk of explosive spread of this disease and really of having avoidable deaths. In terms of different states being in different places at different times, one thing that we've emphasized is there have to also be criteria to tighten again if there is an increase, to tighten the faucet as well as loosening the faucet, and to do that very quickly. That means there'll have to be a way of encouraging people to shelter in place immediately if there are problems. That means also that there'll need to be ways to scale up contact tracing, testing, isolation, quarantine, to surge in when there are cases or contacts and prevent a cluster from becoming an outbreak from becoming an epidemic. On the third question, which what you asked first, what we're seeing around the world is a lot of concern for cross-border and even within country travel. If someone comes from a place where the virus is spreading widely and goes to a place where it's no longer spreading, they may well spread it there. This is new. In some ways it's inconceivable, but there are scenarios in which it would be in the interest of an area to say, we don't want other people coming in, or if they come in, they have to quarantine in this place for 14 days first. That's happening around the world. What we hope is that every community will do a good job so that all of us can be safer.
Thank you. And our next question is from John Tazi at Bloomberg. Do states or local governments have a good sense of what the RO basic reproduction number of the outbreak is in their areas? And is there a target for what this number should be before considering lifting some mitigation measures?
There's been a fair amount of discussion of the R0 or R0. This number turns out to have been quite high initially. It was as high as 14 on the Diamond Princess cruise ship and appears to have been as high as 5 in initial days here in New York City. This emphasizes just how highly infectious the COVID-19 virus is. And that also shows how seriously we have to take this. In terms of measurement of R0, or sometimes called RT over time, we've outlined this in our latest Science Weekly at preventepidemics.org. I invite you to read it. It is a somewhat theoretical number. It can be estimated, but if you look even at the best estimates, they have a pretty wide confidence interval. We aim for an R0 below 1. Once the R0 falls to less than 1, the number of cases will decrease. Boxing it in is a way of getting the R0 to less than 1. More practical indicators might include indicators of testing, isolation, contact tracing, and quarantine. Because if we get those 4 things right, the virus will have more and more difficulty escaping and harming and killing those in society, particularly those who are most vulnerable.
Thank you. Our next question comes from Siki Yao. Do you think there will be a second coronavirus wave this winter? And if so, how can we address it?
There is no way to be certain what's going to happen in the future with this coronavirus. It could mutate. It could behave differently in different climates. We just don't know. What we do know is that it has been terribly deadly. It has been the worst public health disaster in 100 years. And it still can do an enormous amount of damage. Most people in the world haven't been exposed. We don't yet know how it will behave in parts of the world like Africa and Asia, where there has not been a lot of exposure yet, where there is much less healthcare capacity, and where the potential for death and destruction is enormous. Time will tell, but what we do know is that the more we do now, the safer we'll be when we go out again.
Thank you so much, Dr. Frieden. And that was our last question.
So I'd just like to end thanking you for your attention, encouraging you to read the report and contact us if you have more questions, and recognizing that we are all in this together. It's all of the world against the virus. And the sooner we get these 4 corners right, testing, contact tracing, isolation, and quarantine, the sooner and safer we can come back out. We all want to return to as much of a normal life as we can, but we also want to do that without risking killing hundreds or thousands of people because we've done that too soon. And I'm encouraged to see the kind of collaboration we're seeing within and around the US and around the world, because together we'll come out of this battle-scarred but stronger. Thank you very much.